Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about sun damage and what the sun does to our skin. So unless you're a vampire and you're living a nocturnal life where you're not getting any daylight exposure and just living your life at night, we're all going to get some sun exposure to our skin. Some of us are going to react worse to that sun exposure than others, and it's going to depend partly on the amount of native melanin or how much skin pigmentation you already have in your skin, which helps to deflect some of the UVB and some of the UVA rays. Although all of us are prone to sun damage, so no matter what skin type or skin color you are, we should all be wearing sunscreen to prevent those deep UVA rays getting into our skin and then causing aging, loss of collagen, and skin cancer formation. So let's talk about some of the changes that we see when the sun hits our skin. We start to see pigmentary changes, so we can have dark spots appear. We can also have light spots appear, and sometimes that gets confusing to patients, but sometimes we will see sort of this mottled appearance where you have light spots and dark spots, and both of those are actually caused by sun damage. And then, of course, the formation of fine lines and wrinkles over time. That is a direct effect, usually of the sun and pollutants in the environment that cause a breakdown of the collagen fibers, along with, of course, aging issues. And then we see the formation of possible early skin cancers. So you can have precancerous lesions, which just look like crusty areas on the skin. But we, of course, always are on the lookout for anything that might be suspicious for a skin cancer. And the three most common type of skin cancers we see are basal cell carcinomas, squamous cell carcinomas, and melanomas. So we're always on the lookout for that. The sun can also cause melasma in both men and women. Of course, we see that more in women, but men can actually get melasma too. And it presents as a deep pigmentation in the skin, usually in the forehead, cheeks, and the upper lip areas. And it can be fairly difficult to manage, and that is usually a combination of sun exposure and hormones in combination. So if you are, for example, on a birth control pill, it may be a good idea to switch to something different. Of course, it sometimes happens during pregnancy and you just can't help it. But I'm sure that we've all noticed that our skin in areas where we tend to keep the skin covered, of course, ages better and just looks healthier than the skin on our face, neck, chest, and hands. Those are the main areas where we tend to get sun exposure. We also have to be careful to protect the tops of our ears and the scalp, especially if we're starting to get some hair loss. Of course, you can come in and get PRP for the hair loss. And of course, always wear a hat. I highly recommend wearing a hat and big sunglasses. You know, they should make sunglasses that like cover your whole face. That would be ideal, right? Short of that, I would suggest that we all wear sunscreen pretty much every day if we can. And some of the makeups that a lot of the women wear also have natural sun protection in it. Also try to avoid going out in the middle of the day when the sun is at its peak. So if you're going to go for a walk or out to the pool or anything like that, try to do it earlier in the day or later in the afternoon when the sun is just not as intense. And you can always look for that UV index, which is usually listed on some of the temperature apps that are out there. So let's look at some slides together. This is just showing all the different things that can happen as a result of the UVB rays and the UVA rays that penetrate through the ozone layer and are able to get to our skin. UVB rays penetrate a little bit shallower. They don't go quite as deep, but they're responsible for sunburn and skin cancer formation. And then you have the UVA rays, and those actually penetrate deeper through to the dermis of the skin, and they are more responsible for the aging signs in the skin, such as the wrinkles and fine lines. These are some changes that can occur if somebody gets a lot of sun exposure over the years, and it is a cumulative thing. So Just be aware of that. And it starts early in your childhood, even with sun exposure, and all that damage just keeps accumulating and accumulating as we age. Of course, there are procedures we can do to keep reversing some of that sun damage, which is great. And then there are some products that are also very helpful. But if gone unchecked, then of course it just keeps accumulating. And so here you can see the formation of deep lines and wrinkles, just sagging in the skin because loss of elastin and collagen fibers, which makes the skin just loose. And then, of course, the redness and the broken capillaries, which also appear on the surface of the skin. The other thing that happens just in general with the skin as we age is that the blood vessels begin to shrink. And that also contributes to loss of elasticity in the skin. So I just wanted to point that out. And of course, this can happen in women and in men. Men tend to wrinkle a little bit less in the areas of their beard especially, but they're certainly prone to all the same kind of sun damage that we women are, though the thin skin is more prevalent in women, and men tend to have a little bit of a thicker skin, but regardless, it happens. And this is an example of some more sun damage where the primary symptoms are the pigmentary alteration. So you can see a lot of brown spots and sort of this mottled appearance to the skin. This is an example of melasma, where the patient has these very specific patches of pigmentation in specific areas that signify and indicate that this is melasma. This is the mottled pigmentation I was talking about earlier on the arms, for example, where you have brown spots and also light spots. And this is another example of pigmentation. This is after one of our procedures here in the office. We have a lot of different procedures that can help us go from here to here. The most popular procedure would be something like a broadband light treatment, which is a light-based treatment that specifically targets pigment and pulls it off the skin and rejuvenates the collagen at the same time to give a nice glow and a brighter appearance overall and reverse a lot of the sun damage that has occurred. But there are also other procedures we can do, such as microdermabrasion, hydrofacials, microneedling, fractional radiofrequency treatments, fractional laser, and then of course we have the laser skin resurfacing and profractional lasers, which are phenomenal. And you should watch some of our other videos where I talk about some of these procedures to really get an idea of what they do. Here's another example of a laser treatment that has given a really nice improvement to the accumulated sun damage over time. You can see all the pigmentation is gone, the skin is just brighter and healthier and looks younger. Now, of course, this can happen on the chest and neck areas too, so we see a lot of sun damage on the chest area, and here you can see how beautifully that has cleared up. Here's an example of hands. Hands can often tell your age, so it's a good idea to, when you're treating your face and neck and chest and getting rid of the sun damage, consider treating your hands and lower arms as well. This is an example of something we call poikiloderma of Savant, where you develop this sort of reddish pigmentation, usually on the neck and the chest areas, along with pigmentation. So it's red and it's brown, and it looks kind of mottled and unsightly, and you can tell that usually the center part of the neck, right in the middle under your chin, usually stays nice and spared because it's shadowed from sun exposure, whereas the sides of the neck and the chest, where you get the sun exposure, have the symptoms. So very telling of how the sun really does damage the skin over time. And here's another example of that poikiloderma of Savant, and there are wonderful laser treatments we have that actually can help us minimize and get rid of these problems. This is an example of a scalp, and especially in our patients who do not have as much hair, be very careful about that. Make sure you wear a hat. because you can develop a significant amount of sun damage that can lead to skin cancers and other problems in those areas. So I just wanted to talk a bit about skin cancers because that is something that we're really cognizant about and look for when you come in. So if it is a precancerous lesion and we're able to laser those off or use another type of treatment to specifically just take off those little spots, we can do that. But if we are suspicious about a skin lesion, then we are going to biopsy that skin lesion and make sure we send it off to the lab and have it checked. And if it is a skin cancer, then we will take other measures to remove it based on the kind of skin cancer it is. But these are different varieties of what we call basal cell skin carcinomas. So they can look like nodules. They can be sort of a flat red area that's just really persistent. And you know, sometimes we don't know for sure, but let's say we've done a laser treatment and that spot is still persistent, then we're going to be more suspicious about it and biopsy it. This is your typical presentation of a basal cell where you have kind of this rim, like a crater with a central depression. And then this is another type of basal cell that's not as pink and it's more camouflaged with the skin, but you can still see those raised borders that make it suspicious. This is another type of skin cancer called a squamous cell carcinoma, and these are usually preceded by what we call actinic keratoses, which are precancerous rough spots on the skin. But when it progresses to a squamous cell carcinoma, sometimes you can get a central ulceration and just that redness, and this requires treatment and removal. Luckily, most of the skin cancers are very easily removed. They don't generally metastasize or spread unless they are really far along. So the earlier we catch these, we can treat them and get a 100% cure, essentially. This is an example of a patient with a lot of actinic keratoses, which are the precancerous type of skin lesions. And it's common to have these usually frozen off, and there are also topical creams you can use, like Effudex, that help to actually get rid of some of these actinic keratoses. When you use Effudex, you have to apply it for a few weeks, and it looks pretty bad for, let's say, usually about 4 to 6 weeks during the procedure, where it highlights and brings up all the skin lesions to the surface, and then it helps them to go away. So that is an effective way to treat it with a prescription medication. But we can also use a treatment called photodynamic therapy in the office, where we apply a medication to the areas that are affected, and that medication soaks into the actively dividing cells of the precancerous lesions. We leave it on for maybe an hour or more, and then we use a light to activate that medicine that is now actively absorbed into those precancerous skin cells, and it helps them to exfoliate and come off. So the recovery time from this is just a few days, and you can go from here to here even within a week or two versus 4 to 6 weeks of using a topical medication, going through the trauma of that. So it's just a nice option that we have, luckily, that we can use to clear up skin. Here's an example of what that might look like. This is before treatment. During treatment, you can see how the photodynamic therapy is able to highlight and pull up all of the precancerous lesions, even in areas where it wasn't so visible or you didn't think you had problems. We usually treat the whole face for completeness, but for example, here in the cheek, look how it brought up areas of precancerous lesions that were not as visible, and then the skin looks, of course, a lot healthier and clearer afterwards. Here's an example of somebody who actually has acne. So we're not talking about acne today, but I just wanted to mention that photodynamic therapy is also excellent for patients who have acne. That medicine also absorbs into the acne lesions and is able to get rid of them. This is afterwards a little bit more of a severe reaction, but it's good to see that for understanding what type of reactions could be seen afterwards, and then clearance of the skin. This is one procedure because we're using a photosensitive medication to apply to your skin. You do want to be a vampire, actually, just for about 48 hours to avoid UV exposure, which can heighten and give you more of a sunburn reaction afterwards. And then this is another patient with sun damage, a lot of redness, rosacea-like issues on the skin, and this is before photodynamic therapy and then after photodynamic therapy. Wanted to talk about melanomas because that's perhaps the most dangerous kind of skin cancer. Luckily nowadays we have much better treatment options in the oncology world for melanomas. But again, if they're caught early, they can be excised and we can usually get a full cure. This is, for example, what some normal moles might look like, and these are all different types of melanoma. So we look for asymmetry, like for example, most moles that are benign are going to have symmetry, but if you draw a line in the mole somewhere and you see that the two sides don't match, then that would be the condition of asymmetry. You can have uneven borders where the borders can sometimes look scalloped. It doesn't look as regular. You can also have multiple colors within the mole. So a mole that is uniform versus a mole that has different colors in it. And then you can also have moles that are just larger and they're growing in size, and those are all things that we want to be cognizant about and take care of. These are, again, different types of melanomas and different types of normal moles. So we're always on the lookout for these things because that is very important to handle and take care of. So that gives you a bit of an overview of what the sun can do to our skin. Again, it can cause wrinkles, it can cause pigmentation changes such as brown spots and light spots and melasma. It can cause us to start sagging in our skin because the loss of elasticity. And then, of course, it can lead to skin cancer. So just make sure you do the best you can. Wear a broad spectrum sunscreen. We can help you with that. We have some really elegant formulations that don't make you look pasty, but even blend in with your own skin color. That'll help reflect the light. Make sure you wear protective clothing when you're outdoors. Make sure to wash your hands. A lot of times patients, when they're driving, will get a lot of sun exposure on their hands, so just watch for that and try to cover that. Also, we tend to see more sun damage on the left side of the face in the majority of our patients. Again, just from driving, you tend to get more sun exposure coming through the window, unless you tend to be a passenger, in which case we're going to see more damage on the right side of your face. So usually we can tell if you're a passenger or driver just from the amount of sun damage on your skin. We can use special UV cameras to also capture and see the extent of damage on your skin, and that's always very interesting, and it can be kind of awe-inspiring to patients or a little shocking sometimes to see that. But the good news is that we have some really good treatment options to get rid of sun damage, and then also we're really just cognizant about making sure we're not missing a skin cancer on your skin. So that is it. Hopefully that was informational, and let's all be careful of the sun in the future.